Welcome to Info Medical Cards, your trusted source for quick, high-yield medical reviews. Don't forget to like, share, and subscribe. A 52-year-old male patient arrives at the emergency room with sudden onset chest pain. He has a history of stable angina, but this time, the pain started while watching TV. His vitals are relatively stable, ECG shows no signs of infarction, but his pain is rated 9 out of 10. Pain localization is also not typical. What do you suspect? Yes, it's unstable angina or non-ST elevation. Acute coronary syndrome, NSTEACS. NSTEACS is an umbrella term for unstable angina. It's otherwise known as non-street elevation myocardial infarction. It occurs due to partial blockage of a coronary artery, leading to myocardial ischemia but without ST segment elevation on ECG. How do you proceed? Would you consider administering nitrates to this patient? The European Society of Cardiology and the American College of Cardiology, American Heart Association both still consider nitroglycerin as first-line medication for symptomatic betterment. However, it is not a mortality-reducing medication. Nitroglycerin spray is administered sublingually while the patient is seated or typically propped up lying position to avoid severe hypotension. Start with 0.3 to 0.6 mg sublingual, up to 3 doses in 15 minutes. If pain persists, switch to IV nitroglycerin, start 5 mcg per minute and titrate. The mechanism of action of nitroglycerin is simple. The spray acts by dilating coronary arteries and reducing the preload. This decreases myocardial oxygen demand, easing ischemic pain. Before administering nitroglycerin, always consider the following contraindications to avoid dangerous complications. First, if the systolic blood pressure is below 90 mm of mercury, nitroglycerin can worsen hypotension, leading to syncope or even cardiogenic shock due to reduced preload and afterload. Second, in suspected right ventricular infarction, often indicated by ST elevation in right-sided leads like V4R, nitroglycerin can severely reduce preload, which the right ventricle relies on. This can result in profound hypotension and cardiovascular collapse. Third, if the patient is bradycardic, with a heart rate below 50 beats per minute, nitroglycerin may exacerbate hypotension since the body cannot compensate with an increased heart rate, resulting in poor perfusion and possible syncope. Lastly, recent use of PDE5 inhibitors, such as sildenafil or tadalafil, is an absolute contraindication. Both nitroglycerin and these medications raise cyclic GMP levels, and when combined, they may cause life-threatening hypotension. Always confirm the patient has not taken PDE5 inhibitors within the last 24 to 48 hours before giving nitroglycerin. In all these cases, reassess the need for alternative therapies and consult cardiology when in doubt. Why a maximum of 3 sprays is recommended? Nitroglycerin is limited to a maximum of 3 sublingual sprays within 15 minutes for safety. Excessive doses may cause severe hypotension, dizziness, or reflex tachycardia. Each spray needs time to act, and rapid dosing can cause uncontrolled vasodilation. Limiting doses also prevents nitrate tolerance. If chest pain persists after 3 sprays, the patient is considered a non-responder. Prompt escalation to IV therapy or reperfusion strategy is necessary. Nitrolingual, a small spray that delivers a big relief in the nick of time. A systematic clinical approach can often save lives. So stay tuned, like, share, and subscribe to www.youtube.com/infomedicalcards for more quick emergency reviews.